Welcome to the Healers Café, conversations on health and healing with Dr. Manon.
So, hello and welcome to the Healers Café. And today I have with me Dr. Hamid Elmyar. And we met during another conference, and I just fell in love with his story and his passion. And so it's really a great pleasure to have you here on this show. So I understand that you went from being a doctor into public health. And I wondered if you could just sort of explain, how your life unfolded on that level. So.
Well, absolutely. Thank you so much. First of all, it's a pleasure to be on your show, Dr. Manon. And of course, we met at that event, and then I have to, learn from you and what you do, and I really appreciate what you're doing, and for humanity in general. And thank you so much for having me on your show. And starting with my story and myself, like why do I do what I do? And that's my why. From very childhood, it may sound just cliche, but it's true that from very childhood, I always wanted to help people. And in order to help people, I was looking for ways that I have to finish school, have to do my education so that I can be more helpful. And so after finishing high school, I was thinking about a way to help people and what would be better than, just going to med school. And I'm originally from Afghanistan. I was born and raised there in Afghanistan. And as many of your audience and yourself know, that Afghanistan, unfortunately, is one of the countries that has been suffering for decades now, in terms of security, in terms of lack of, healthcare facilities, as well as education and everything. And in that community that I was brought up, I was lucky enough to finish my school even during this hard time where people were not even able to go to school. Sometimes I was, just going to school, and that's a totally different story. How, if your time allows, on your show, I can tell you a little bit of that experience in my childhood. We didn't have classes like here in the Western countries, in Europe or in America or Canada. We had classes which my class was a tent. I was studying under a tent. Mm-hmm. And we didn't have any chair. We didn't have, desks. We were sitting on the floor with a tarp on the floor. Sometimes even it was raining and it was coming on under the tent. So we had to, just sit on our feet, with shoes on. And part of my classes during my childhood was also in a bus, wreckage, like, just broken bus, which was, no tires, nothing. But we were using that in our school as a classroom. And the days that our class was on that bus, broken bus, I was so happy that today we were there on that bus. So that's how I was studying during my very childhood, and primary school. And finishing high school, I always wanted to help people. Then I went to med school, being the top student in my class during high school. It wasn't that difficult for me to get into medical school. And so studied medical school is 7 years back there. So after graduating, long story short, graduating from medical school, I was just thinking that, now I am a physician. Am I really able to help people? Mm-hmm. And soon I realized that, no, this is not enough. If I want to help people, I have to specialize in something. I have to be more specific. Who am I working with, and how can I be more helpful?
So
I did. Yes.
Can I just stop you there for a second?
Sure.
I mean, so you started with this desire to help, and then how did it get focused to health to start with? Like, how did that? Why health? Because you can help people in lots of things. So why was it health? Was there
That's a very good question, Dr. Mino. Um, there were a couple reasons. One was that basically through health, if everything we do in this world is just, to be healthy and to be happy, right? If it's any type of work, if you're not healthy, you can't do anything.
Right.
That's the bottom line. So I just, was thinking that health is the best way to help people, and especially people who need it, like, patients and other people who need health advice. That would be a good way. Second reason was that back then in Afghanistan, unfortunately, a lot of other majors, like even journalism or engineering or other ones, were not really, there was not an opportunity to, even if you studied that, to work. So I was thinking that if I go to med school, there's always a need,
Right.
apart from my passion. You have to survive. So those two reasons why I chose health.
Because it's funny, when you look at, I mean, I also felt like I wanted to help, but it's interesting that the first choice I had was law, because I felt like you have to be able to protect people's rights and their freedom of choice. So I went to there, and then I realized, no. The only thing that will matter is from the ground up, from the roots up, is if people start to take charge of their health, because that's something that they can control. And it gets more complicated as time goes by, but we'll go into that. But so it's an interesting, what we get brought up with and why we get interested in how we help people. So anyway, so go on. So then you became a doctor.
Exactly. That's a great point too, to know the laws and everything, like, that's important too. So then I finished medical school, and I just was asking myself, am I really helping people? What am I able to do so? And for that, I was also, during my medical school, I was also doing part-time community health, outreach programs with an international organization back in Afghanistan. And that was also part of the reason I wanted to see where am I going? Am I going to clinical work or, public health? So after medical school, and I said, maybe I should do a specialization and do a residency to be more helpful. I did a residency in pediatrics. And the reason also, again, I chose pediatrics because women and children, unfortunately, across the world, especially in developing countries, are the most vulnerable members of the society. And I was seeing that need there in Afghanistan. So I did my residency in pediatrics in order to be more helpful for people. Then it was during my last year of residency in pediatrics, that was a life-changing time that as a senior resident, I was on call, and I was, the days that I was at the OPD with other physicians, we were seeing a lot of patients on a daily basis. I'm talking about 150 plus patients at the OPD, like 3-4 physicians, which is really not the way it should be, and it's not easy to do so. But many of those patients, kids, were coming, of course, with their moms from underserved communities, from that they were suffering, unfortunately, from very easily preventable and preventable diseases, such as diarrhea or bronchitis. And that was the moment I also was on call one night, and I saw patients coming from remote areas, unfortunately 2-3 days on the way, and in critical conditions at the hospital. And when I was looking for the underlying cause was diarrhea or some very easily preventable disease. And unfortunately, some of them couldn't even make it because they came in irreversible shock and heart failure, renal failure, and all that. And that was a moment I was asking again myself, like, am I really helping people? I always wanted to help people. I did med school and then I did residency in pediatrics. Now, am I really helping people? Why are these people getting sick in the first place? And why, a majority of them are coming here from very easily preventable disease? What are actually the underlying causes? What is the root cause?
Mm.
And I can move on or
No,
understand.
well, I think no, I because that's a subject very dear to my heart. What are the root causes? Because if we're to believe that we can take more charge and more responsibility for our health, that doesn't mean not work with a health advisor, a doctor, a health team. I'm not
Right.
suggesting that, but it does start with having higher expectations of what's possible for you and then taking responsibility to act upon some of the things. So to me, it, becoming knowledgeable enough as a public to be empowered is very important. So I'm very curious what to you are the root causes, the real root causes. So
Yes, absolutely. And I totally agree with you. And my philosophy in life is that power is in empowering others. As far as we have that in mind, that to empower other people. And that's why I see the root causes when I mentioned to a couple of problems in those communities, preventable diseases such as diarrhea and bronchitis. There were other diseases, also preventable diseases, but lack of education, unfortunately, lack of awareness about health issues, and those are the main causes, the root causes: lack of access to quality health, lack of basic education like illiteracy, and socioeconomic status. These all play important role in people's health across the world, and especially in the developing countries. So when I was looking for the underlying cause, why that patient, specific patient with the diarrhea, came there in a critical condition, when I looked for the underlying cause, first of all, the entire family were illiterate, so they couldn't even read and write. So basically, they didn't know they didn't have any information or enough information about diarrhea, about basic, personal hygiene and environmental hygiene, and how would it be possible for them to prevent it? And even when, someone's suffering from diarrhea, the basic things that you can give to a kid to help them, restore and rehydrate, restore that energy and rehydrate. But even that was not, you know, it, I could sense the lack of such information among communities.
but it's information, but is it also access, as in not easy access to water and to
Right.
water sources that are not contaminated? Like we have these in the States. I'm from Canada, but I've interviewed several doctors who talk about these food deserts. I think they're
Right.
called that. And it sounds like all there is fast food. There's not one green vegetable. There's not anything with
Right.
value. There's only chemicals and junk in it. And that if that's what food is, then how can food be your medicine, right? Like
Right.
you're destroying your health. But if you don't have the basics like water, like clean water, then
Right.
you have really nothing to the pillars, the building blocks of health are missing.
Absolutely. Absolutely. I can compare later on, like, how the US comparing to the
Mhm.
developing countries. Obviously, in developing countries, it's not much of a fast food thing because we don't even have McDonald's there in Afghanistan or in maybe around some other developing countries or some other fast food like that or chains like that. But lack of as you said, drinking water is one issue. There are places that they don't have access to water. Most places would be, just they dig a well in their backyard or front yard, and they just pull some water out of there in a bucket and drink it that way. um, there's people don't even use, like, maybe that's just some elite families would be probably using bottled water or something like that, or they have kind of the water, the system that can provide them with water. But mostly it's just that type of water. And there are places in the rural areas probably they don't even have that well, which is a little safer than. But then they just go to the river and get some water out of the river and drink it that way. So basically, that water source is very important. And like that, um, the vegetables that they use, many probably don't even know how to wash it or use some sort of like um, chemicals that they can kill the bacteria or the germs in there. But it's a, a whole. If to answer your question, it's both information and systematic obstacles that can cause those diseases. By systematic obstacle, I mean that there is not enough healthcare, facilities. There's not enough even physicians or healthcare providers to provide that necessary information for people, and of course, lack of access to quality health is another major issue. So for that point, and then that was the point, the time that I wanted to help people as a pediatrician, and then realized all those root causes. And I was looking again for some other way to help people, because that was not my answer. And for that to happen, I was looking for underlying causes, and just decided to do a master's in public health. And because then I would be happy and able to reach at a populational level, rather than just sitting in my private practice or at a hospital and seeing patients who are unfortunately already suffering from disease, and they have to spend a lot of money and resources. And then you don't even know if they get well or not because of the quality of medications and compliance in those countries. So I decided to do a master's in public health, and I applied also for a scholarship, and I would say that I was lucky, and of course my hard work paid off to get that. And I did my master's in public health and focus on community health education here in the US. And I always, that's another story when you were talking about the US health and the food deserts and stuff like that. Before even, coming to the US, I was thinking that there is no public health issues here in the US. And then they realized that no, there's definitely a lot. So that's what I do now. I focus on mostly on community health education, community health, and public health, and reaching at a population level, rather than just clinical work. But meanwhile, I also volunteer with a couple of nonprofits where I do also community health education. I also work, at a diagnostic lab. It's a pathology lab that we also diagnose diseases, including COVID, and now that during this pandemic. So I am still thinking that that's another story, but we can probably discuss later, or another podcast. That would be my focus when I focus now mostly on healthcare professionals, because when I was looking to help people, so I did that. I don't want to repeat my story again. Medical school, 7 years, and then 3 years of residency in pediatrics, and 2 years in master's in public health. And now I realize that the healthcare professionals, unfortunately, especially during this pandemic time, they also suffer somehow from the burden and burnout. And that's a major issue if the healthcare professionals are not happy what they do and they are not healthy and satisfied with the job that they're doing, then definitely it affects their productivity. It affects their, the way that they treat their patients. So my focus now, in order to help people and communities, I need to make sure that the healthcare professionals are also healthy and
Yeah.
happy and satisfied, so that we can have a better approach, all from all walks of health. And that's what I'm known for, to bring health professionals from all walks of health around the same table from across the world, to have an upstream approach to health, so that we can have a successful approach to health. And yeah.
Yeah, so I mean, I'm in great agreement with you on that level, but where are you located right now?
Yeah, I am in the U.S. I'm in New Jersey, living in New Jersey, which is northeast U.S.
New York, yeah.
and very close to New York,
Mhm.
20-30 minutes drive.
And what have you found are the major stressors for the healthcare providers? Because I mean,
Mhm.
I'm in Canada. I'm on the extreme other side. My clinic was in Vancouver, and I had many doctors and nurses that came to see me, and that was one of the big subjects
Mhm.
of dissatisfaction and burnout and not feeling, able to perform and do what they know is right. So I'm just very curious, what have you found in the States on the other coast entirely? What have you found from, and then I know you interview people everywhere on this subject. So what are the issues that you've noticed?
That's a very good question. So I before answer that specific question, I also have, I host a podcast,
Mm.
and at my podcast, I also interview physicians and healthcare professionals from around the world, to share their experience and knowledge and insight with the rest of the world. And the burnout is, this is not specifically, I didn't have any physicians talking specifically on about this on my podcast, but with the conversations that I had with some physicians, in my inner circle, friends, there is always that feeling of fatigue and tiredness, and feeling of, you don't really, the work life balance.
Mhm,
I
mhm.
know physicians who are working, long hours, and they can't really even find time to spend with the family and their loved ones,
Mm.
and or leave alone to go on vacation.
Yeah.
And especially during this pandemic time, it's been even, tougher, because a lot of physicians, we needed them, and not only physicians, all healthcare providers, from nurses to, other healthcare providers, to be in the front line. And so that burden, feeling of tiredness and fatigue, and not even, satisfied what they do. Because if you I always mention to my friends about the balance in life, is just like, you go into a gym, you work uh, on all parts of your body, because you want to have that balance. You don't want to work only on one arm and then the other arm disproportionate.
Hi, it's Dr. Manon, and I just wanted to take a moment, commercial break, to ask you to subscribe to my podcast and kindly leave a comment if you're enjoying this. And also, just to let you know, I have tips for people in health looking for solutions to just a variety of issues. It's more like an attitude of health, and they're entertaining short videos, and you can find those under drmanonbolliger.com/tip. The link is here, and I look forward to hearing from you.
The life and work is like that, exactly. If it is physicians, if it is engineers, if it is lawyers and other professions, there must be a balance in life. Your profession work, your personal life, your friends, and your social life. The That's another reason, maybe a lot of, because by nature healthcare profession is very demanding. I mean, it's very tough, and we're always working hard and competing against time.
Mm. Yeah, and lots of
I do have actually, sorry to interrupt, but I do have some statistics,
yeah,
and maybe later on or whenever you want me, I could tell you about the burnout.
absolutely feel free, because I would think too that responsibility has also two edges. It's like
Right,
when you feel responsible, even if you're the mother of a family or whatever, that
right,
responsibility always has to be kept in check with
right,
self-care and teaching that part where the children learn that they need to respect that, and they need their little time to sort their things out and make their own intelligent
right,
decisions. So it's a microcosm of a bigger issue, but as doctors, so many feel responsible, and it's not necessarily that the patient is going to follow or can do or will understand or has enough time to even get the whole picture, right? So it can
right.
be very frustrating. But go ahead, what are the statistics you found? Because I have not looked into this at all. So
Well, yeah, because I also work on a panel discussion that is focused on burnout among healthcare professionals, and I have uh, some of the statistics in front of me here. In 2013, the Medscape Lifestyle Report said that they surveyed 20,000 physicians and reported nationwide, here, of course, in the US, 40% burnout among physicians in 2013. And then they did again in the 2017 report, found 51% rate. So from 40 to 51% in a matter of 4 years, there was a 25% increase.
mhm.
This is only one of the statistics, and this is, as I said, like this was done 2013 and 2017, which we all know that the burden now because of the pandemic is way more higher.
But what do you think? So it's I mean, you said already, it's the life balance, which is a
Right,
big thing. But I'm just wondering, and I'm looking at in Ontario, I know the Ontario Nurses Association was very active, and they said to the government and to the people, thanks for clapping at 7 o'clock. That was great. We felt the support. This is
right,
at the beginning of the pandemic when we really didn't understand this virus
mhm,
and all that. But they said, and then they were trying to get cuts. They were offered cuts in their pay, and they're saying, no, wait a minute here. It's almost like when the pandemic peak rolled down, it's almost like they don't matter anymore. And so I look at that as a systemic problem,
right,
much larger than what the physician, the healthcare provider, the nurse, whichever in the wellness team, what they can do. It's a bigger picture.
right.
And
I,
can you comment on that? Yeah.
I do agree with that part too. There's, part of it is on the physician or healthcare provider side, and then partly it's also with the providers of those facilities. In other words, decision makers and officials who are running those hospitals and governments and local governments, to provide them with the necessary equipment to make sure that they have the PPE, and to make sure that they have support that they need. And that was really surprising if they wanted to cut their their payment instead of increasing it. And just little bonuses that would be encouraging. Not to mention that unfortunately a lot of physicians lost their lives, and other healthcare providers across the world, in fighting this disease in order to help their patients and save their lives, but they put their lives at risk. And that emotionally is also another probably one of the contributing factors in burden and burnout when others, you see a colleague or your senior doctor or mentor is losing, lost their lives in this pandemic. That is of course also those are some other reasons that I agree with you on that.
Yeah. So what part of it do you feel like to, again, back to empowering the in this case, the practitioner, the doctor, what are the things that they could do or it's not so obvious when you have crazy schedules and when you're not in charge of the decision making, you're not in charge of some of the protocols that can be used or not used, even though it should be. But we've seen that change with this pandemic where they're told this is how it's done. And it's like, whoa, so there's been a lot of, a lot of inner turmoil. But I would say there's maybe during any sort of contagious time, there's definitely things that might be different. But how do you, because burnout is an issue outside of pandemics too. So where do you see the non-victim? Because I prefer to think that we're all agents and that we can actually actively make a change. Where do you see starting with that?
Well, that's a great question. In terms of this pandemic time, I would answer your question in two different ways. One would be that specifically during the pandemic time, and then apart from the pandemic in general.
Sure.
So during this pandemic time, even before the first cases of coronavirus was here in the US and around the world, I started raising awareness about some steps from a public health perspective, from my personal experience in treating patients like at a clinical level. I was trying to raise awareness and make sure that people are prepared for a day which is going to be unfortunately overwhelming for a lot of hospitals and physicians and healthcare facilities. So during this pandemic time, people need to be proactive, especially the decision makers and people who are running hospitals and running healthcare facilities. By proactive, I mean that one of the things that they need, as I mentioned, was the PPE. So they have to be prepared to have enough of the PPE at their facility. They have to make sure that they have enough people on the ground. By people, I mean healthcare professionals, so that they can have different shifts, because the burden is way more than the regular days. And if a physician or any other healthcare provider is, staying at the hospital instead of 8 hours, 12 hours, that definitely they need to rest. So in order to rest, they need to have the next shift. Like if they can have different shifts instead of 2 shifts or 3 shifts, making sure that they have enough people at different shifts so that they can have the virus under control. They also make sure that their healthcare providers have time to rest.
But just to interrupt you here, but so you're looking at it though from public health perspective, which is what you're in. I totally get that. And so that's more what administration can do.
Right.
What can the doctors or the nurses do when they're in the situation that they're in?
That's a great question, and I wish I had all the answers for them. And I admit that I don't have all the answers. That's why I believe in collaboration, and I have a whole team of professionals, and I am really interested in working collaboratively to have a package, holistic package, if it's for public, if it's for healthcare providers. And for healthcare providers, of course, one thing that is really important that I want to mention here is that as healthcare providers or physicians, we always think that, oh, we know this is a problem, this is a disease, but we never think about solutions. We we take it easy, or we ignore it, sometimes, unfortunately, it's a stigma that a healthcare professional or a physician complains about burnout or complains about, other issues that they are seeing on a daily basis. And that is, I think, the main reason that my focus is on healthcare providers, and the main reason why a lot of them don't get the necessary help that they want, because unfortunately, a lot of people would be just, oh, this is incapability. You're not capable of doing your work. You're complaining and all that. But to go back to the life work balance, if a physician is not taking care of his or her own health, how can he or she be able to take care of other people's, their patients' health? And for that to happen, I have a group of experts from medical doctors to naturopathic to functional medicine physicians to psychologists, clinical psychologists, to other public health practitioners, other health practitioners who are working from a neurobiofeedback. And what really happens is not necessarily just what we read in the textbooks, because when the that burnout happens, it has many actually reasons. And I was trying to I was noted actually a few important points here. I wanted to mention that the best one is the MBI, and based on their definitions, the burnout is according to it has three components: emotional exhaustion, depersonalization, and reduced personal accomplishment. So when we think about these important three measures, three components, it doesn't really, writing a prescription is not the solution. So for that, I have a package of these, whatever is needed there. And that will be on my panel discussion with those.
Well, I very much look forward to listen to that panel discussion and then see what happens with that, because I think it's very much needed. And I think too it's having a platform for discussion, which is very important, because what at least my observation of this pandemic, which is not a popular spoken view, but it does seem that there's been a lot of doctors and healthcare people speaking out saying, hey, in this hospital, they're using zinc or in vitamin D, and they have high vitamin C injections. And it's like, there's nothing, no coverage, no media, no nothing. And the doctors who are involved in that are seeing, results that they want to talk about. They're not massive studies, but it's like there's a desire when you go into the profession to help people, you want to help people. And it's like, if you're doing something that seems to have an impact, it needs to be further studied and looked at, but it needs to be shared. And the same, I remember several of the doctors speaking out as well when they didn't understand the nature of the virus, and they were using these intubation and the respirators were actually at fault. Now, no one's at fault because we're all just learning. I get that. But the point is, there wasn't a voice, there wasn't a place to share those concerns or those observations. And not being in practice right now, just noticing all of this, it's a huge stressor when there isn't a real, genuine platform for caring about people and how it works. And it seems so vested in people and industries that have so-called solutions, whether it's this vaccine or this. I mean, so it's not that there isn't much money to be made, but which seems to be what runs a lot of this. But the doctors and nurses and healthcare practitioners I don't feel are getting their voice heard, and it's not safe for them to share. And that's what I find the most scary, my perspective on this. Yeah.
Well, yeah, of course, I agree with you on all of it, and it's this pandemic was, pandemics don't happen like every year, and that's not a type of disease that we were seeing on a daily basis as healthcare practitioners. And of course, it was new, and it's still new. It's been already a year into this coronavirus pandemic, and we are still learning. So when something is new, a disease is new, a virus is not known, there's no medication, there's no vaccination for that. Obviously, it has, it's the impact, the negative impact of that virus is way more than a virus or a bacteria which is known. If we know if there's a bacteria, we have medication for it, so we know what protocol should we use, what to tell for the patients, and how long will it take, what kind of medications are we prescribing. And but this was new, so that's another.
But I think the fact that it's new doesn't, they're separate things to me. It's that it's having, and that's why I love the idea that you have a platform where medical professionals can actually talk freely about what they saw, what they're experiencing, what's going on. Because I do think that as a collaboration, they're in the best position to see what's going on. And we know very well that these numbers, they've gone from crazy to nothing, then tests, then there's questions about tests, and it just keeps going and going. And it's very confusing from the public. But as a healthcare professional in it, it must be, it's so important, I think, to have that freedom to talk and see what's happening in a free way. I'm trying to think, there's a group of, I think it's 40,000 doctors now who have signed together to collaborate. I'm trying to think the name of it. It's escaping me, of course. Oh, goodness. I think it was started in Germany, but for that very same reason of let's have frank discussions, but that's more to do with this particular pandemic. I think the question you're raising is also a general one, which is what motivated your life from going into public health.
I just mentioned briefly that I wanted to focus on both sides from during this pandemic, and then in general. The general part was that that package I mentioned, that because we need a holistic approach, we need a collaborative and more systematic approach when it comes to burnout, or during other regular days, because the burnout is not a problem only during pandemic. Of course, in pandemic it increased, but it's a ongoing problem.
Definitely. Okay, well, our time, I can't believe it's already it's already over. I feel like we could have many discussions, but so any last words you want to leave everyone with before we close?
Yeah, and first of all, thank you for giving me this opportunity to be on this platform and share my experience with you and with your audience. So the message is, most of belief that I have is that health is not limited to private practices and hospitals. It has to start from every individual, communities, school systems, everywhere. And for that to happen, we need to raise awareness. We have to look for those underlying causes and root causes, and we have to have a collaborative, systematic approach to health in order to save people's lives. Also, not only helping our communities, but healthcare professionals themselves as well.
All right. Okay. Well, thank you very much, and it was lovely to interview you.
It's been a pleasure. Thank you for having me.
Thank you for joining us at the Healers Café with Dr. Manon. For more information, go to drmanonbolliger.com.